Hi, this module I'm going to share with you how to evaluate if a patient has chronic gastrointestinal issues actually has a brain-gut axis dysfunction. So in order to do that, you're going to have to really evaluate sympathetic and parasympathetic functions. There's really two main types of brain-gut axis dysfunctions. One is just impaired parasympathetic activity. With impaired parasympathetic activity, you're going to see things like decreased tearing, you're going to see decreased saliva production, so you definitely want to look at those in the exam. We'll go through that. You want to check their palate response, you want to check their gag reflex, and that will give you some indication of what's happening directly with the vagus nerve in that scenario. We'll listen to their bowel sounds, and you want to listen for frequency of sounds and then the intensity of the sounds. And those are all related to looking at parasympathetic function, which is essential. Now, if you see those impaired, then there's a possibility they may have a brain-gut axis issue. Now, unrelated to impaired parasympathetic vagal function, there's always the possibility someone has brain-gut axis issues that are gut-related because of dysautonomia that's leading to increased sympathetic function. So looking at their pupils, seeing if they have dilated pupils or abnormal pupil responses throughout the exam, heart rate variability issues, poor circulation, abnormal sweating, those are all indications of increased sympathetic tone or so-called dysautonomia. So a main reason for many people that have chronic gut issues despite changing their diet and taking various nutraceuticals and not responding is some impairment in these central-based pathways. So I'll walk you through how to do each part of the exam for that, and then we'll conclude and talk about some of the things as far as applications go with these exam findings later. Okay, so we're going to look at a parasympathetic function. This parasympathetic function, you have to remember that there's a group of nuclei called the brachial arch derivatives. Cranial nerve 7, which is involved with tearing, cranial nerve 9, which is involved with saliva production, and then cranial nerve 10. They all fall on one series of tracks across the brainstem. They're called the brachial arch derivatives. They're phylogenetic homologs. They come from the same embryological tissue. So when parasympathetic function is down, you may see expressions of those in different tissues altogether. Now, if we just look here with the lights on, here you can just look at the eyes, and we just want to see if they have tearing. And if their eyes are shiny, then it's nice and healthy. So we can see that she has really nice healthy tearing. Usually with people that have lack of tearing, they have like a dead eye, dead fish kind of look, where there's no shine. So those are normal. Now, for some people, when their eyes get really dry, you can get some redness. There's a little bit of redness here, but you can still see that nice shine in the eye. So if you see people that have dry eyes all the time and have to constantly put drops in their eyes, and they even come into the exam with droppers, then you might suspect there's decreased parasympathetic activity. Then you want to look in the mouth. Go ahead and open here. You just want to see that shine of saliva. And if you see that shine of saliva, then you know that they're producing saliva. If it's really dry, you can see a nice shine there. That's healthy saliva production. You can actually go back here and look at the salivary duct, and you can see that saliva is coming out that way. You can see the duct right there. And then you can go on the other side and see that nice glow of saliva production. So if you see decreased saliva production, they'll also usually complain of increased needing to chew. It takes them forever to get through a meal. And certain medications can decrease dryness that are unrelated to brain-related issues as well. Okay. Now let's look here in the light. We'll look at the gag reflex. Look at the palate. So go ahead and say ah. And you want to see that palate move. And do it again. And relax. And then again. Great. Now you want to look at those arches, and if you see those arches move, everything's working well. With her, it's working really great. But then you want to do this repeatedly, so you have to do it like 10 times in a row. Go ahead. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And you can see that they kept moving the whole time. But people that have some brain fatigue issues, vagal issues, they'll fatigue after 4 or 5. They just won't move anymore. And then you just check the gag reflex. You just push on the arch, see if they move. And remember, sometimes people have neurons close to threshold. The other thing you want to do is have the person stick out their tongue and see if you can get a gag reflex on their tongue. You shouldn't be able to do that. But if neurons are close to threshold, you'll actually even hear a gag sometimes just on the tongue. Most people, you have to actually go back to the arch and deduce the gag reflex that way. Okay, the other thing you want to do is you want to look at the abdomen and you want to auscultate. So if you use an electronic microscope like this, you can, a stethoscope, electronic stethoscope like this, you can hear things much clearer. And you want to hold and listen to all 4 quadrants. You want to hold for anywhere between, 20 seconds to a minute, depending how intensely you feel like this may be an issue. And you're just basically looking for that abdominal contraction, a smooth muscle contraction of the intestines. And it should be pretty strong. It's hard to tell you what normal sounds like because you're going to have to listen to lots of different abdomens to identify what normal is. And then you can see what's abnormal. And you also want to get an idea of when they ate last. Great. So the other thing you want to do is you want to look for increased sympathetic tone. So increased sympathetic tone, you want to look at the pupils. You want to make sure the pupils are not dilated. You can see here the pupils look nice and healthy. And other times you'll see pupils just like constrict and dilate all the time. You see that with abnormal sympathetic tone. You want to see if there's any abnormal sweating. Sometimes you'll have the patient lift their arm up. They'll have a nice sweat spot or have just sweating that's increased more on one side versus the other side. You want to look to see if there's any signs of poor circulation on the nail beds. Cold hands, cold hands in her. You can see nice pink nail beds are not white. So people that have really increased sympathetic tone have really cold hands, white nail beds. A lot of people have that because of poor circulation. But if you see that with dilated pupils and symptoms of anxiety, and then if you use a pulse oximeter, you can put it on here and look at the heart rate. And if you see the heart rate's really high, if they have any kind of heart rate variability, then you can get some indications that they have increased sympathetic tone. So that could be another reason why you may have some brain-gut axis issues. So here you can see the heart rate's nice and healthy and normal. People that have increased sympathetic tone, you can see this like in the hundreds, 90, and then I'll go like 95 to 84 to 92, and then just go all over the place. Those are all indications you have abnormal sympathetic patterns, which you'll see with brain-gut axis disorders. Okay, with brain-gut axis disorders, you have one type in which there's decreased parasympathetic activity. And with decreased parasympathetic activity, if you remember from the exam, you can see decreased tearing, decreased saliva production, abnormal palate movement. When you have them say over and over again, you see those palates just start to fatigue on you. It's really important to do repetitive testing. And when you see these decreased parasympathetic responses, they're usually because there's a cortical dysfunction. So the cortex, the brain, different regions of the cortex fire down to the brainstem and activate these vagal centers, and then that's where you get these autonomic parasympathetic responses. Now, with people that are younger, you can see it, for example, in childhood developmental disorders, when the brain's not developing, they don't develop that brain-gut axis issue, so that's something to be aware of. You'll see abnormal palate movement and parasympathetic activity, and sometimes in young children with developmental disorders. With people that are older, like in their 20s, even teens, and even younger adults, or even older adults, there's many times a past head injury that's now lead to a chronic gut dysfunction that's there. They may also have accompanying symptoms of SIBO because they're not getting that motor response in their gut, so they're getting those distensive responses. They may also tell you that they can't swallow very well. They may ask you to give them powders and liquids versus capsules because they have a hard time swallowing. Those are indications that the whole vagal pathway may not be working. Now, as people get older, there's also the possibility of neurodegenerative diseases. So multiple systems atrophy, and even certain types of alpha-synucleopathies and Parkinson's disease and Lewy body disease and things like dementia, they can start to aggregate proteins in different regions of the brainstem and cause decreased parasympathetic activity. So, developmental delays, brain injuries, and neurodegenerative processes may cause some of these brain-gut axis disorders. And to increase parasympathetic activity, the easiest thing to do is like gargle, or have their gag reflexes on the tongue, or just generally improve their brain function. Now, the other thing we talked about in the exam was checking for gag reflex on the tongue. So remember, when neurons start to degenerate, they lose mitochondrial function, and neurons get close to threshold. So any trivial stimulus can cause a response. So sometimes instead of seeing an absent gag reflex, you'll see neurons close to threshold from the degenerative process, where you can induce a gag reflex just on the tongue. So you always want to be aware of that. And then when you listen to their abdomen, that's another key essential part of the exam. It's not the most important, but you really want to listen to their bowel sounds, really hear those constrictive responses in humeral regions, and compare that with everything else. There isn't one exact finding that's going to give you a clue, but if you see some examination findings that are showing decreased parasympathetic, and then you see symptoms of decreased parasympathetic and their brain region localization form, like constantly constipated, have to use laxative all the time, can't swallow, can't get the heart rate down, those are all signs that they may have decreased parasympathetic activity. And if they have a chronic gut issue, they may have a brain-gut axis dysfunction. In those cases, you really have to work on their brain and activate those vagal systems. Now, there are some people that increased sympathetic tone, and their gag reflex is fine. They have saliva production, they have tearing, but they may have abnormal sweating. They may have poor circulation, cold hands, cold feet, white nail beds. They may have dilated pupils, heart rates varied all over the place. That the heart rate variability issues, heart rate can sometimes exceed 100. Those are sympathetic tones. Now, in some people, their parasympathetic function is intact, but when the brain is injured, the brain actually has pathways that dampen sympathetic function in the intermediate lateral cell column between T1 and T12 that increase sympathetic activity. So another consequence of brain injury is not just decreased parasympathetics, but increased sympathetic tone. And you may see a combination of increased sympathetic activity and decreased parasympathetic activity, but if you see any of these examination findings with anyone who has chronic gut issues, then you may suspect a brain-gut axis disorder. Thank you.